So my first question is, how did you decide that this is the job that you wanted?
How did I decide on whether to become a psychologist
Yes.
or to? Oh, I've always known that I enjoyed, you know, because I've always enjoyed listening to people's problems and helping them problem solve. It's just been something that my friends always, joked about that I was their therapist. And a girlfriend of mine in sixth grade, in high school, she showed me a letter that I wrote to her when we were both in sixth grade, and it told her, in it I stated, when I'm a millionaire psychologist, I'll give you free services. And I thought we got laughs out of that. I'm not a millionaire psychologist yet, but
That's really funny.
so I thought since I was 12, I've known that it's the path.
Oh, that's good. What is one thing that you love about your job?
I find it rewarding to see people get better, and I get a chance to do that and be a part of that process.
Hmm. And then,
Mm-hmm.
what is one thing that you hate about it?
One thing that I hate about it, hate about being, I don't know that I hate anything. I guess um, I don't like dealing with insurance companies. Yeah, that's it.
That's a good answer.
Yeah, insurance billing. Yeah, I actually hate that part. Yeah, can't do that.
Okay,
Mm-hmm.
so now specifically for phobias, um,
Mm-hmm.
what role does a person who has phobias play in your career?
Uh, what role? What role do I play in
What
terms of
role
helping
do
a client?
they play in your career? Like, do you have like a lot of experiences with them, or like
Yes.
how often do
Um,
you?
my training. So I was trained in the trauma and anxiety recovery program at Emory in the Department of Psychiatry, and through there I was able to work with a number of people who suffered. Well, it started off with fear of flying, a flight phobia,
Mhm.
and they kind of extended out into other types of phobias. And as postdocs there were those of us who saw people with driving phobias, dog phobias, claustrophobia. One of the things about phobia is that, or having a specific phobia, which is the technical term, is that people often have multiple phobias, or they have a co-occurring panic disorder or agoraphobia. And so during that training, I was able to learn a lot about the, I guess, nuances of this disorder, and also about the gold standard treatments for it. And since then, I've been in private practice, and I've been seeing clients. I would say maybe a quarter of my clients continue to be people who struggle with specific phobias.
Okay. Um,
Well, it fluctuates. I'd say between 15 and 25%. Yeah.
so that's really interesting. So what are some like trends that you see in your patients? I guess you mentioned like the dog
Mhm.
one and flight. Um,
Mhm.
and there are like symptoms and stuff. Any trends
Mhm.
in that?
What are the symptoms
Or
of
like
a specific
common,
phobia?
yes. Or just like common.
Okay, so well, to meet criteria or to be diagnosed with a specific phobia, you have to rule out other things. And once those things are ruled out, to say someone has a phobia, they must one experience significant distress
Hmm.
um, when they encounter whatever that fear stimulus is, and so they either experience significant distress, and they also, or they may avoid it, so they find reasons to not have to confront this fear. They also tend to have other disorders, meaning like a panic disorder, or their phobias kind of extend out into other things. For example, you may have a person who's afraid of small spaces. As a result, they end up like claustrophobic, but then they end up fearing anything like an MRI machine or a plane, any place that's enclosed. And so you may think that this person has a flight phobia, but they also have claustrophobia.
Mm.
You have to figure out and tease apart what's primary. And then sometimes it gets tricky with panic disorders because a lot of them do have a panic disorder, and you may the trick is to figuring out what came first. Is the panic disorder something that caused them to develop a phobia, So, for example, if you had a panic attack on an elevator, did did you become fearful of elevators or cold spaces because you were afraid of having a panic attack, or was it more so about the elevator itself? So you almost have to go through all of that because then the approach would be a little different if it was the panic attack that made them afraid
Right.
versus the space. Did I answer your question?
Yes. Yes.
Other patterns, some of these people they struggle with general anxiety. They were. I'm noticing that a number of them report that they were anxious kids. And
Right.
their parents struggle with anxiety. And so you have children who were chronic worriers, and they grew up and became phobic adults.
Okay. Yes. Um, and so then what are would you say are the biggest challenges of dealing with people who have phobias?
The challenge of dealing with people who have phobias, maybe the getting them to confront the fear. The treatment of choice for phobia, well, depending on the type of phobia, but is exposure. And so, if we're talking about social phobia, then it means exposing them to social environments where they get to confront those fears. If you have a fear of flying or driving or heights or small spaces, we can talk about it all we want in therapy, but the biggest challenge is getting you into that very place and sitting with that anxiety and fear and learning that you can handle it and learning that whatever it is that you were worried about is actually probably magnified and helping you to challenge those fears in the moment. So the biggest challenge is getting people to that step. Oftentimes they're comfortable coming into session and talking about it, but once you start planning the actual exposures, the in vivo exposures out in the field, that's when they want to drop out of therapy or they'll find excuses
Right.
so that might be the biggest challenge.
Then what is the most unexpected incident that has happened to you interacting with patients with phobias?
Well, it didn't happen, but it was the first time a person I was doing a virtual reality exposure therapy session where I had a client who was afraid of flying. I had him pretend, well, he was in a simulated world, a virtual world, but sitting on a plane, and he was started to heave. He was about to vomit or throw up. I later learned that that's common during exposure.
Mm-hmm.
That's not common. I'm sorry. That's not. I should not have been surprised, considering how fearful he was. But that was the most surprising thing. I didn't expect someone to almost throw up. He did not
Right.
throw up, but I was still surprised by that.
Hmm.
So I had to give him the wastebasket, and he held onto the wastebasket throughout the entire session.
What would you say is the most effective form of treatment? Because in my research, I saw, like you mentioned, there's modeling, watching them do it and exposure, and
Mm-hmm.
other ones. What would you say is the most effective?
I would say that exposure, any kind
Exposure.
of exposure-based therapy. So there is exposure response, prevention. That's more so for OCD, but it's also helpful
Mm-hmm.
for phobic patients. And when I say exposure, I also mean in vivo exposures, just as the name entails, in real life exposures, going out into the world and confronting that thing. There's virtual reality exposure, which is, as the name entails, taking them into a virtual environment.
Mm-hmm.
And, you end up putting a headset on their head. It's almost like a video game. And you take them on that flight, or if it's a fear of spiders, you take them into this virtual world where they're covered in spiders and they see spiders crawling all over their bodies, right?
Mm-hmm.
Um, and then there's imaginal exposure, which is having them go through the imagination in their mind and confronting that there and sitting with that anxiety. So, I mean, of course, there are others who do just sort of cognitive behavioral therapy where you sit and you talk about the fears, you challenge the fears, and you try to think of evidence and probabilities and likelihoods and have them identify what thought distortions are taking over when they're in the moment and that they're yielding to. Others do, yeah, there are others, you can do a number of different types of techniques, but anything exposure based, I think, is the research shows most supported, the most um, effective.
Right. That makes sense.
And just to add to the exposure thing, that exposure based therapy falls under cognitive behavioral therapy, so it's almost an extension of it.
Oh,
So you could say, in a broader scope, cognitive behavioral therapy is the most effective, but you have to be specific. exposure therapy is the most effective.
Okay. Um, then do you remember any memorable cases? Like, what is the most memorable case of a patient that you've seen?
Most memorable. I had a client who probably the MRI phobia.
Mm-hmm.
Client with an MRI phobia, and I obviously don't have an MRI machine, and sitting in my office, and so I called around and I found a place, a clinic that was willing to let me use their MRI machine. We ended up not using it, but I learned that that was an option. But to make a long story short, in my office, what I ended up doing was I brought a blanket to work and a tube, like a not a tube, but like a board that could be rolled into a tube,
Mm-hmm.
and I had the patient crawl into that, and the blanket made him really hot, and he kind of had some of the same experiences he had in a prior MRI session. And the client used mindfulness technique to get through it because we had been working on breathing and challenging the thoughts, and also sitting with the anxiety. And he did really well. And this was someone who refused to go for an MRI, and he had cancer. He had a medical procedure that needed to be done, but he had to have an MRI first.
Mm-hmm.
And so he went through with it and was able to get the treatment that he needed.
Wow, that's awesome. So have
Mhm.
you, I guess you do have to sometimes get creative with your job and
Yes,
like
yes,
apply different techniques
we
to
do.
it. So has a patient ever had a personal effect on your life?
I think I think I don't know how others have answered this question, but I think all of my patients I am affected in one way or another.
Mm-hmm.
I learn from everyone. I can't say there's anyone I have not learned from, and so it affects my parenting. It affects how what I say and do to my daughter, because sometimes I think, oh wow, uh, I have had a client who told me that when her mother said that to her, that it had such a profound effect on how she did something. So then
Oh, right.
so I modify myself and the feedback that I give. So it changes everything.
Right.
It changes everything.
Um,
I can't say any more than others. Mm-hmm.
yeah. Have you ever wanted to quit or change careers?
Um, I Psychologists are able to do a lot, and so meaning you have the flexibility to teach at a university. You can work in a counseling center. You can have
Right.
your own private practice. You can work in a hospital, a community health center. I mean, it really varies. Or you can just do consulting. You can consult with other clinicians or do supervision. So I do often think about, okay, what are other things I could be doing, because I am someone who gets bored easily. Um, but not to actually leave the profession. No, I don't know. I mean, probably in the earlier years, I
Right.
thought about it while I was in grad school. Maybe
Mm-hmm.
I still wondered whether I wanted to be a psychiatrist or something else. But since I've been in the career, no, I don't think about changing.
And then has your profession ever overwhelmed you?
Yes, so burnout is a real problem among psychologists, which is why it's important that you focus on work life harmony, and you also have to focus on boundaries. Um, so if I am someone who I struggle if I'm seeing more than 5 clients a day. I can I've seen 8 to 9 clients a day, sometimes 10.
Mm-hmm.
Especially when I was in an inpatient hospital. But in private practice, I try to limit myself to 4 or 5 a day so that I'm not overwhelmed, so that I can be fully present with each person that I see. Because you can get overwhelmed, especially if you have seen maybe 4 or 5 heavy trauma clients all in one day, all very horrible stories, and you have to
Right.
be empathic for each of them, and you have to
Right.
listen and be present for each of them. That can cause a lot of feelings of just fatigue. So, yes, it happens. It's something that we always have to be on the lookout for, and it's something that a lot of mental health clinicians have to struggle with.
That's really interesting. So my final question is, um, I have to, for part of my final project, I have to
Mm-hmm.
interview a patient. Is there any way you could put me in contact with one or know how I could get in contact with someone who has
Was
experienced
one of my
phobia?
patients? Well, I think because by law I'm not allowed to do that. I could ask them
Okay,
if they would be willing to. So I can. I mean, because I'm moving this week, I don't see many people this week.
right.
Um, but I can. I don't know how soon you would need that. I can put out a call to to the clients and ask if they'd be willing to talk to a high school student for their project. But I also need to know because my goal is I'm always trying to protect my clients,
Right,
and so of course, if you're going to be talking about their treatment or how they're doing, you need to make sure that it's not something that can cause harm or
right.
come back to bite them. You know what I mean?
My teacher
So,
my teacher said
hmm?
that if the patient doesn't want the information to be presented, because we do have a presentation, then she can just like listen to the audio file to make sure that I did it like by herself, so that it's like not um,
Okay.
shared with others. But um, so
So
even just someone,
a phobia client.
yes.
Well, I have had a client who was interviewed by a television news reporter about her treatment,
Hmm.
but I'm not in contact with her anymore, so I wouldn't be able to reach her. So clients are very open about talking to people about their phobias and how treatment went and
Right.
whatnot. So I could just ask, but the other issue is I don't see any phobia clients this week, so it wouldn't be until next week.
Okay.
Um,
The
that you would
latest
even.
that I would probably be able to get it by would be like Wednesday or Tuesday. So
This week?
of next week.
Of
Um,
next week?
um,
Okay.
um,
It's interesting because I had a driving phobia client that was scheduled today.
oh,
Um, and I'm not sure if I will have her on the calendar for next week, but she may be someone who may be interested. I can ask her.
thank you. Just anyone, who has any sort of experience, that would be very helpful. But only if they're
With,
comfortable, obviously.
with, with, but phobia specifically, right? Because I
Yes.
don't only treat phobias. My main expertise, like I said, my training is in trauma and anxiety, so I see a lot of trauma patients.
Right.
And phobias is considered an anxiety, one of the anxiety disorders. So it's only one subset of all the anxiety disorders that I treat.
Yeah.
So all of my clients are phobia clients, I guess is what I'm trying to say.
Oh, okay.
Um, so I have to wait until I see one of my phobia clients, and then I'll ask. What I can do is I can reach out to the one that was interviewed by the news reporter and see if she'd be willing to talk to you. I could do
Okay.
that.
That would be
But
perfect.
she's not. I haven't. She's not been my client in over a year.
Right.
So I don't know if it's someone that needs to be in active treatment now.
No, it doesn't. It just anyone who has experience. So I can just
Anyone
ask
who
them
has experience.
like questions
Okay.
like how it feels and like day to day, just a more personal level on the subject.
Yeah. Okay. I'll ask her since I already know that she doesn't have a problem with her information being out there. She's very open and she talked. I mean, thousands of people probably saw the news segment on her. Um, it was on. I don't remember what station. She might even be able to share that with you.
Okay, that's
And you kind of see me in it too. So.
oh, that's awesome.
Yeah. Okay, so yeah, I'll send her an email, and perhaps maybe she'll be okay, and then from there I'll give her. Would I give her this number
Yes, this is my cell. That would be perfect. Or you could give her my email, whichever one.
or your
Uh,
email?
I
Okay,
emailed you.
okay. So then, if you don't mind, can you send me an email at the end of the week just to check in, and I can just make sure that
Sure,
I've contacted her or reached out to her.
sure. So I will
Okay,
send you a reminder email. Is that what you're saying?
sounds good. All
Okay,
right,
perfect. Thank you so much for all of your help.
no more, no problem,
All
no
right,
problem.
thank
Take care.
you.
Bye bye.
Bye.